Okay, welcome to this episode of the Athletic Fitness and Nutrition Podcast. My name is Paul Burgess, and I have a guy back on today who I rate really highly in the field that I practice in, and he's been around for a long time. He's been on the show a few times as well. Pete Williams, welcome back, mate.
Hi, mate. How are you?
I'm very good. Just a quick background for Pete. First IFM qualified functional medicine practitioner in the UK. That's right, isn't it?
Yeah, first certified.
Certified.
Yeah.
Been running a practice for the odd 20 years, like I say. But then recently, I was trawling through social media as you do, and he popped up with a brand new thing that he's doing, which was really exciting because I kind of know some of the other people involved. And it just looks like it's going to be the next step in functional medicine practice and what you guys are doing. So I'm quite excited about this. We were chatting just now before we started recording, and I said to Pete, look, stop talking because everything you're saying we need to get recorded because it's just some really exciting stuff. So, mate, tell us about what now is this current project that you're doing.
Well, as we said, I think there is a groundswell in, I suppose, with the general public, but I think within medicine anyway, with regards to, actually, we probably need to be thinking about humans and health from a point of view of a systems approach, from a point of view of local is always going to influence systemic. So, isn't it about time that we started all trying to work out how all this fits together? And it seems more and more when you read the literature. In fact, I was speaking to Ian Craig a couple of weeks back, and we talked about a very recent paper that came out actually in the sports medicine literature, showing that maybe we should be looking at athletes from a point of view of a systems perspective. And that has many implications with regards to how we periodize them, how we look after them, how we treat them, etc. So I just think it's that time. I think there is a movement that's been happening for many years, and I think we're at the forefront of that movement. And I think for us, as I said to you, we have grown as a practice, but I think there are more and more people understanding, number one, this other approach, which is a functional medicine model, which is essentially a systems biology model. And more people have been around enough to read that maybe this is the approach for you. This is many people present with complex chronic conditions that cannot be solved with quick fixes. And again, this is a conversation we talked about, is that, we've had many people come back to us. Some people from 5 years ago we refused to work with them because they were expecting for us to do a few things for 6 to 8 weeks and we'd solve the issue. And we said, this is just not the way this works. This is root cause medicine. To get to the root cause of why you're ill, it's going to take us a considerable amount of time. And so I just think for us, and again, from my perspective, we've just grown, and the need for our services has grown. And what I wanted to do was to develop a consultancy and a practice that has IFM certified practitioners on board. I think there's about 26 or so now who have been certified in the UK. And I wanted to work with people in a collaborative approach who are all IFM certified practitioners, but all had a lot of experience in that process. And that just works on many levels, Paul, because I think the reality is with this is that, we are being approached now by very conventionally led medics. And we had a conversation with an NHS dermatologist last week, can we have a think about maybe, working with you? And as I discussed, which sounds crazy, but I'm presenting at quite a big dental conference in June, simply because they're starting to realize that actually what happens in the mouth has a systemic effect on the body. And so I'm going to be there presenting some of the work that we've been doing over the last couple of years with oral health. But actually just sort of trying to get some real clear messages out to dentists, and that is that, you know, what they're doing as far as treating your teeth and your gums and that oral microbiome has a massive effect on systemic health. And so I think just more and more people are coming towards this component that actually we've got to, while yes, we can treat locally, we have to always think about what systemically is going on, and how is that local treatment potentially affecting the systemic picture. And we've just got, you know, as you know, we've just had a lot of experience in this. We've made lots of mistakes because we've had lots of patients, but we've learned from that, and I think we're going to go forward with a really solid and robust consultancy. So
I think something you also mentioned was that people who previously were under the influence that it's going to take a much shorter period of time to fix some really big problems, have gone and tried everything, or been to lots of different people that said, yeah, I can fix this, I can do that, whatever else, and still not got fixed. And then have realised that actually maybe the people like me, like you, and other practitioners who are saying, look, this stuff doesn't take 6 weeks or 12 weeks. This takes months, and if not years, to really figure out what's going on and to start improving it. Because, you know, even at the beginning, you think, okay, I've got a pretty good understanding that, understanding that these are the things that we need to address. But as soon as you start addressing them, you don't actually know what's going to happen, because everybody's very unique and individual, and bodies are going to react in different ways.
Absolutely.
So, you know, and you made a good point. You can get worse before you get better.
Sure. Yeah.
But now they're understanding that actually it's a longer process. And I think the GPs are also coming to that understanding. I spoke to my GP recently, and he said to me, so do you really think we can fix thyroid issues without medication, without pharmaceuticals? And I said, yeah, pretty much. And he went, oh, that's really interesting. But, you know, this guy was in his mid-50s.
Sure.
Had plenty of experience, you know, but all they know is that writing out a prescription thing.
Yes.
So they're definitely starting to drift out.
And I think what you'll be clear about, and I'm clear about, is that it's not the clinician, it's not the traditional clinician's fault. In fact, you know, I sort of get a bit perplexed by way people, you know, potentially always have a go at medics for, you know, throwing out drugs, and you know, I don't really know any medics who choose to willy-nilly throw out medications at conditions. They're doing what they've been trained to do.
Exactly.
And they don't know any other way. And I suppose for many, most of the ones I know are hugely frustrated at it. You know, it's a bit, as you say, it's a bit like that dermatologist. She knows that she can't solve most of her patients' problems because it's a complex condition, and just throwing steroids at it, all right, I mean, they are needed at certain circumstances based on where the condition is at, but she knows that that's not a long-term strategy. So, you know, I think we've also got to give many of the medics, I think we've got to lay off them, because I think we can sort of bias that medics are bad and nutrition is good, and I just don't think that's the case at all.
No, I don't. And also the only challenge I've got is they're coming from the right place. They've been trained to do what they're doing because they want to help people, and it's a passion of theirs. Yeah. But they don't have time to go and learn other things that are going to help them. They have to, you know, they've got 10-minute appointments and they're stacked out.
Yes.
Yeah,
so the model is wrong. Yeah. Which is unfortunate.
Yeah, but then you look at Rangan Chatterjee, and he's getting out a really good message that actually there's a lot more functional stuff, lifestyle work that can be done, and he's getting it out, and he's getting good exposure, and you know, doing a great job. But there's still, you know, it's only scratching the surface.
Agreed.
So with you guys, you were talking again before we started recording about a test that you've been using for oral microbiome.
Yes.
Because all the chatter, you know, for the last few years has been about gut microbiome and, you know, how that influences everything and blah, blah, blah. But you're the first person, in my experience, to start talking more succinctly about oral microbiome. Now, many, many years ago, and it's probably still the case, if you did a sports nutrition course, the first thing they would say is make sure your athletes have got good oral hygiene. Now, it had nothing to do with the microbiome. It had to do with make sure they haven't got any broken teeth or decay or cavities, because they're not going to be able to eat the food we need to give them to perform.
Yeah.
There was nothing else that they were interested in. But, you're looking at it from a much, much more localized and what's going on in their perspective. So tell us more about that.
Well, I suppose the best way to introduce this was to sort of tell you why we got into this in the first place, and that was because, Paul, you probably have a view of me is that you're in the field and you think that you sort of look after yourself pretty well and you're pretty fit and healthy. And for me, it started about 5 years ago now. I was having a little bit of problems with my teeth. I've never had any problems with my teeth at all. I'm just about to turn 50, and so I went to the dentist, and she said, Mr. Williams, there's a bit of problem with that back tooth, but you've got advanced periodontal disease. And I'm like, what? I said, almost like said, do you know who I am? I said, I should, if anyone knows what's going on, I should think I should. But of course, for many people, periodontal disease is completely silent for them. So, they don't realize that maybe they've got some gum recession or they've got some pockets around their teeth because they don't have any pain with it. And that was the first time I ever noticed it. And so, of course, as probably you would have done, and we all do in this field, is that, right, well, I better start thinking about, what periodontal disease and what it leads to. And, of course, that opens the world up for understanding that, and number one is that your mouth has a very specific oral microbiome, and depending on the health of that oral microbiome, there is always a risk from a point of view of how that oral microbiome and that bacteria have a way that they can potentially influence most of the chronic diseases that we're dealing with. So when you start to peer into the literature, you find there is overwhelming evidence to look at how oral bacteria have a strong influence on cardiovascular disease. And in particular for me, I was interested in because of the cognitive decline and Breslin protocols that we use at work, that oral bacteria have an influence on Alzheimer's risk. And literally when you start reading the literature, type 2 diabetes, liver disease, autoimmunity, particularly rheumatoid arthritis, all have influencing factors from the bacteria in the microbiome. So the big caveat to this is that of course it's a bit like a border, and I suppose this is how we understand the gut now, is that what we're looking to do, aren't we? We need a border that is well protected and doesn't have too many holes, and it has a security force that dictates who can and who can't come through. Now, of course, if you've got periodontal disease or gingivitis or gum recession or bleeding gums, then you have open borders where these bacteria can very easily get through. And so it's a simple thing. So I think one of the clinical pearls from today's conversation is that if you have patients who have cardiovascular disease or any chronic disease risk, and they've got poor oral hygiene as far as periodontal disease, as far as pockets around teeth, as far as gum recession, as far as bleeding gums, then they have a border that is open for bacteria that could be pathogenic